Ever wonder what motivates people to get plastic surgery? Did they regret it? What can we learn from the stories of plastic surgery patients? I'm Dr. Javad Sajan, and this is the Plastic Surgeon Podcast. Hello, welcome to the Plastic Surgeon Podcast, where we listen to real plastic surgery stories of triumph and pain from real patients and providers to further understand the motivations of why they would risk their life under the knife. Today, I'm so excited to have Dr. David Santos on the show. Dr. Santos is a world-renowned, esteemed, board-certified facial plastic surgeon. He's someone who's done thousands of facelifts. He's here today to share his experience, his stories, his motivations, his ambitions, his stories of pain and triumph. David, thank you so much for being on the show. How are you?
Excellent. Thank you so much for that intro. I love it. And I also love your music. The music's great. I want to just dance when I hear it. So,
David, tell us about yourself. Where did you go to school and where are you from?
Well, I'm initially from California. So I did my undergrad at UC Berkeley. Of course, that's where all the action is these days politically, but fortunately, it's been a while since I've been there. I went to Tulane University Medical School in New Orleans for 4 years and did most of my training in California at UCSF and the Bay Area in Oakland, California, in otolaryngology, head and neck surgery, and then also went on to do a facial plastic surgery fellowship in the Midwest in Indianapolis with Dr. Bill Beeson, which was a fabulous fellowship. Love facial plastic surgery, love facelift surgery. I've been in Seattle now for over 20 years and have settled down here, working enthusiastically doing facelift surgery.
David, why do you like facelift surgery? What's so good about it?
Well, it's one of those things it's a chemistry thing. You just sort of fall in love with it when you first see it. And the first facelift surgery I did was with Dr. Stephen Mathis at University of California, San Francisco, who's written a lot of the textbooks in terms of plastic surgery. Also, Jack Anderson in New Orleans was the first plastic surgery that I ever witnessed. And so, right from the beginning, it was just a love fest because it's something that you just love. You love it because it's so intricate, because it's so delicate, it's so refined, and it makes a huge difference for people. And so once you see that, once you experience that, then it's just something you fall in love with. It's a labor of love. It's not everybody has a job and gets a paycheck and so forth. This is just something you just love to do.
You often see doctors specialize in one particular type of surgery. Is it because they're not good at the others? What specifically about facelifts attracts you to it?
Right. So a long time ago, I had the choice of doing general plastic surgery, breast augmentation, liposuction, cosmetic that way, but I really chose facial plastic surgery because there's so many reasons, but one is the intricate aspect of the face and the neck and delivering the best answer you can for the particular challenges that we see in the face and neck. But, over the years, facelift surgery became the thing that I just love the most. There's a demand for it. There's demand for good surgery. And all you have to do is talk to many of the patients that after they have a facelift surgery, they have it done well. They are excited. They are enthusiastic about it. It changes their life. And so, me seeing that, time and time again, it's something I fell in love with.
That's amazing. And I don't think anyone in this city has done more than you. And one of the things that you're the most known for is being able to do these surgeries under local anesthesia without general. Now, I know in some circles that's controversial, and you do it all the time. Why is local? How is it possible really to do a facelift under local? How are you cutting off half of someone's face, making it tighter without putting them to sleep?
We don't cut off half the face. we just tighten it up and make it look good. So, local anesthesia, I think, is still not standard in the plastic surgery world, as best I can tell. I think that my training and most surgeons' training is that for general anesthesia for facelift surgery, and indeed, it isn't something you can do if you're only doing a few facelifts. You can't do it on a local if you're just doing 10 or 15 a year or something like that. And indeed, if you look at the surveys for ASPS or plastic surgery groups and so forth, the average number of facelift surgeries a plastic surgeon does is in the 10 to 20 to 30 a year. There are a handful of people that do more than that. But in order to really be good at facelift surgery under local, you just have to do a lot and have that training to do it well. But there's so many good reasons to do it under local anesthesia. And I think that there's an occasional individual that says, you know what, you got to put me under just general anesthesia and that sort of thing. But the truth is that over 90%, 95% of our patients we do under local, and it's a choice of the patient. And I think that the elements that go into that are pretty important.
So I want to hear what you have to say. Before we go further, can you tell our listeners what's the difference between local and general? I know me and you know because that's what we do. But tell the listeners.
Right,
please.
right. So general anesthesia, of course, we're using an anesthesiologist, a nurse anesthetist. We're going to sleep. We're putting a tube down into the throat, into the lungs, so that you're breathing with automatic anesthesia.
So you're on a ventilator and all that.
Ventilator and so forth. You're right. And so that's needed in traditional and a lot of our plastic surgeries that we do are that way. Local anesthesia, it essentially you use one of the main components to it is the tumescent anesthesia component, which is using a dilute lidocaine mixture to provide excellent anesthesia to the areas to be treated. And so this is a main component of it, but also we're not doing IV sedation. We're doing oral sedation, oral medications, usually a benzodiazepine type of combination to provide excellent, what we call anxiolysis, or basically, sedation. You're not completely asleep, but you're very, very comfortable. And that's titrated and treated basically for each individual in a fashion that is tailored to the individual's need and so forth. So it's a local anesthesia that can be done, separate from the general anesthesia component.
So does the patient have an IV for local?
So you have an IV access, of course, but you don't need the IV medication. You're using oral medication. So the benefit of oral medication over IV, oral medication, it's going into the gut, and the gut has a very good way of providing medication slowly to the system over time. That's not as rapid and as IV would be. So it's a very natural, tailored medication for anesthesia. So
the patients do get an IV for a local surgery, or not always?
Well, I think it depends. I think it's nice to have that. You don't necessarily have to. There are accreditation issues that sort of dictate to have an IV access, but essentially, we do it or can do it with just oral and not even have an IV.
So when you say local, that's sort of similar to what the dentist does when you get a cavity fill?
Right. So the yes and no. So the dentist is using his her methods to provide anesthesia to the teeth. And you get this little shake to the cheek, and sometimes my dentist is so good I don't even feel it. And we're doing that component too. But the tumescent component provides more than just that local, just little shot. We're providing a diffuse amount of anesthesia throughout the area to be treated, which of course is underneath the neck, around the ear, in the face, and so forth. And so that tumescent anesthesia stays and provides anesthesia for hours, and also provides hemostasis. And there's also discussion about preventing infection and things of that nature. So it's a combination treatment that provides a really good. So it's different than the dentist, of course, because of the tumescent component to it.
How long does it take to do a facelift under local?
So it does vary, but I think that in a normal situation, it's an hour and a half. When you throw in additional steps to it, then it could be longer.
So you can do an entire facelift in about 1.5 hours?
Yeah. So if you have just a simple facelift, that's an hour and a half. And then we throw in other things like what we call platysmoplasty, which is a small incision underneath the chin that provides tightening of the neck area. Then that might add a little bit more time. And then you throw in the laser component or the fat grafting or the blepharoplasty, all these other things that add time to it. But if you just want to do a simple, for instance, a mini facelift, then you can do it in an hour and a half, and certainly. But we really don't count the time or look at the clock and so forth. We just simply get it done. But you can do it in an hour and a half as a decent average.
Are the patients moving around when you're doing it?
Yeah. So with the oral sedation, it's actually beneficial to move intermittently. We're not completely still as if you're sleeping or as still as if you're general anesthesia. So there's not a lot of moving around, but a little bit of moving around is great because when we get it, so this is one of the safety factors of local anesthesia. Movement provides safety in so much that general anesthesia where you're not moving for 3 hours, 4 hours, there's risk for blood clots and things of that nature. So under local, that risk goes down substantially because we're moving intermittently. But essentially, to answer the question appropriately, yeah, patients are not really moving. They're sort of still, but once in a while move their hip and move their leg and that sort of thing.
And I've looked at your work, and the local work that you do is better than I think what many people can do in general anesthesia, at least as good, if not exceedingly impressive. Do you feel that when you're doing it under local, you're limited in what kind of surgery you can do?
No, not at all. The main thing in terms of getting a great result, I think number 1, 2, and 3 is experience. Really doing this a lot, knowing all the tricks of the trade. Experience is just huge. I can remember back when I first started doing facelift surgery, and just it's a lot to it, and the more you do it, then all of a sudden it becomes really intricate, easy to get a great result. But I think experience is real important. But so the local anesthesia, I think it helps. But there is no way that general anesthesia or local anesthesia one better than the other in terms of the result. But there is a big difference, I think, in terms of the safety and the desire of the patient to not have to go under general anesthesia. For instance, general anesthesia, comparing the two, there are studies out that are starting to talk about particularly for individuals over 60 or 70, that it could potentially accelerate dementia, that sort of thing, with general anesthesia, doing repeated general anesthesia procedures. So we're avoiding that with the local anesthesia. And then, like I mentioned, the aspect of diminished risk of blood clots or deep vein thrombosis and so forth when we do that under local, and that's established, I think. And then patients don't have as much nausea and vomiting afterwards because with local, because we're not giving you that big bolus of anesthesia that you see with general anesthesia. And then also the complications of general anesthesia or airway problems and so forth are not inherent, not present with local anesthesia. So I think that the other one I think is really great is that patients can actually walk out of the operating room if they want to. We usually use a wheelchair, but they're capable of getting up, and they're more clear and more together. And the number of times after general anesthesia where it sort of still lasts and you're still out of it that night, even the next day, is something that we see with general anesthesia. So local anesthesia just has a number of positive benefits that outweigh the general anesthesia aspect. But again, it can't be done if the surgeon is just doing it 4 or 5 times a year. It's really something you're doing repeatedly with a great team, and you get it done real well, efficiently, and patients benefit from it with that lower risk, I believe.
And I know you've taken care of thousands of patients, and you must have so many stories that come to mind. Can you share with us a story of a patient you've done under local that really stands out to you?
Well, I think that approximately 70% or maybe 75% of our patients are women, and I think that one of the main things that we see is we want to feel good about ourselves. We want to feel good about where we are in the world, and so many of my patients, just say things like, preoperatively, they'll say things like, I want to matter more. I want to be part of the conversation. This one lady that I remember her saying that she walks into a room and she feels invisible because people don't pay attention to her, don't look at her, don't think that she's, just that older person in the room. But I do have one patient that I always think of that approximately 65, and we did a procedure on her, and she had a great result and so forth. And so a couple weeks, like a month after the procedure, she goes off from here, Seattle, all the way to San Diego with the girls and have a girls' trip. and she just had her procedure done. And so the girls did what the girls do, and she got asked out by a young man. And so they went out for dinner. Just this, young man she met in San Diego, and they're sitting talking and so forth. And eventually it came to, well, by the way, how old are you? and she says, well, I'm 65. And he says, well, I'm, 40. So,
Wow.
so, and so it was kind of a surprise, but it's not to say that we get away with it that way all the time, but it's just to say that you can make a change in your life that makes a difference. And I have another gentleman who worked in a factory, and all the men in the factory were in their 30s and 40s and so forth. And he was, in his 60s, 65, and he wasn't part of the niche, part of the boys club. He was sort of the old guy, that, sort of separate from the group. And so he had something done. He looked better, and it gave him more confidence. And, he wanted to be more part of the boys group. So there's various stories. I mean, many, many stories about impacting your life, whether it's dating or in the workplace, or just, feeling better about yourself.
What do you think motivates people the most to seek out a facelift?
Well, I think that one of the things I see commonly, two things I'll see commonly. One is that they're, see themselves in a profile or a picture that was taken, and look at the picture and look at themselves, or look in the mirror and just simply say, that isn't me. And they feel, much younger than they're looking. And so it comes to a head, and they just say, I got to do something about this. I'm not this person that I see in the mirror. And let's make a difference there. And so that's one thing that's very common, and one thing that we, make a huge difference on the before and after pictures. People, after a month after the surgery, they look at them and they just say, this is phenomenal. This is great. The other one I see is just individuals who are younger, in their 40s and, 50 or around 50. And you'd think, well, that's not somebody who needs a facelift. But I'm seeing it more and more where somebody comes in and says, well, I don't, I still look okay, but I want to look better. And those individuals are real surprising to me, because it wasn't something that I'd seen back in the, 15 years ago, 20 years ago, but more and more is coming to head. Maybe it's because of Instagram, or maybe because their friends are looking good and they want to keep up with them. But we're seeing folks in their 40s, or women in their 40s, and you can get a little oomph there, a little tightening, a little lift, and you can see that before and after, and it just can sometimes blow you away.
Do you think people taking more selfies is leading them to get more facelift surgery?
No, so I think that the main thing that I see really is the one I mentioned first, which is they see themselves in a picture at a wedding or maybe an Instagram, and they look at that and they say, this just isn't me. And so that's someone in their 50s, mid 50s, 60s, and so forth. And that's a big one. That's traditionally a big one. Probably the most common patient that I've seen is that story. But in terms of Instagram has influenced a lot of other things, and it really is huge. And the big one that you'll see, of course, or we've seen, of course, is the Kardashian lips. And so people come in and they want the Kardashian lips and so forth. So that's a real influence that we've seen quite often. But yeah, so right.
And Dr. Santos and I do facelifts differently. The only way I do them is with general anesthesia, and that's the way I was trained. It's the way I'm the most comfortable in. I think the way you do it is really impressive, new, it's cutting edge, and it's innovative. And for a lot of patients that I've seen in their 60s and 70s, what I'm noticing now more and more is they don't want anesthesia. They prefer to do it under local because they perceive as lower risk factors. And that's what I see too, as far as the ambitions of people. They don't feel like themselves, and they don't feel like themselves because they don't see themselves in the mirror. So when people are having a facelift done by you, do you see this change back in how they perceive themselves? Are they feeling more like themselves?
Well, I think what they really come to say once things have healed up is that looks more like me. And that's really what we really want to do. And the number one thing on the list here is to be natural. Of course, we don't want to look different. We want to look like you, like me. And that's just a huge, huge aspect. Nobody wants, there's always the discussion about the Hollywood bad results before and after and so forth. That's actually a rarity. It's not what we see. We see natural. We want natural. We want to look like who we are. And that's what we see time and time again. And I always tell patients beforehand, we're working on looking natural. We're not looking at tightening things up so it looks like it's windswept or anything like that. We're trying to get it to a point where it looks natural, but looks like you. And so if you really look at it in terms of before and afters, I can't tell patients, oh, this is going to give you 10 years. But what we see in general is 10 years to 15 years. Rarely we'll see 20 years, but we have seen that. The minimum is 8 years difference. And that's what we're trying to do is, you and I are aging, all of us age. We can't change that. That's just part of the ball game. But what we can do is take us right now and back up 8 years, 10 years, and 15 years. Let's back it up and because we still have the bone structure, the jaw, the cheeks, the neck, deep neck structures, that's still there. That's still us. It's just this soft tissue and the fat and the laxity and the sagging that's occurred. We're going to remedy that. And so by remedying that, restoring that to its normal youthful position, then we're going to get you back. We're going to get, a natural, and natural is just really what we, really focus on. But we're trying to get things to look like you. So we really don't, it's extremely rare for somebody to say, well, it doesn't look like me. It really is, who you are, what you used to look like.
Yeah. David, how long does a facelift last that you do?
So this is a common question everybody asks. So how long is it, going to last? And the way I look at it, one of the things I always say to patients is if you had a twin sister or twin brother and you had it done and they didn't, then of course you're going to look better than they are today and this month and this year. But essentially the result, the change is a permanent change. And so you will always look better than your twin sibling, 10 years from now, 20 years from now, 30, 40 years from now. And indeed, I have some patients where I have some twin patients, one who's had it done and the other who hasn't. And you can see this change over time. So that's the concept. So we're moving backwards in time today when we do the procedures and we look better today. But of course, we can't stop the aging process. But essentially, this is a permanent change, but we still age. The number of times that somebody at 10 years or 15 years says, "Hey, I had this done, but I want to have it done again." Yes, that happens, a repeat procedure, but it's really less than 8%, 5% of individuals. So once you have one lift, usually you're not going to get a second one or want a second one. But there is a small aliquot of patients that say, "Hey, yes, let's do some more," because they want to get that tightening back again.
So it sounds to me like you're setting the clock back 10 years ish, something like that. But then the clock keeps ticking. Would that be a good way of thinking about it?
Right. And we don't aspire to be 70 years old and look 40, but we do aspire to be 70 and look 55 and look 60. And that's a reasonable desire. It's a reasonable expectation. And we see it all the time. And so often I'll see patients that I haven't seen in a year or so. They come in and I walk into the room and I look at them and ask myself, well, how old is this individual? And generally, when you inspect it, it generally is at least 10 years younger than you might think. Just looking at their appearance.
When you do facelifts under local, aside from the anesthesia risks, are there any extra risks for the procedure itself?
Yeah, so there's always risks with all surgeries, as we know. And the way I break it down is that certainly we have the common risks that just happen: the swelling, bruising, discomfort, and that sort of thing. And occasionally we'll have some bleeding problems that we have to remedy, and occasionally we'll have an infection that we have to remedy, or bumps and lumps and so forth. So these are common. We remedy them in short order, but after a week or two, these things have taken care of themselves.
I know everyone's different. Everybody has different risk factors, but on average, how often do little complications or little bumps come up when you get a facelift done?
Yeah, so I think of it as common, and that's okay as long as it's temporary in the realm of 1 week, 2 weeks, 3 weeks, and no more than a month. And so that's just part of the ball game, and we sort of tolerate that. And so I always tell my patients if they can just be patient for a week, 10 days, that these things will smooth themselves out. And that's a better way of looking at it. If you want perfection after a day or two, that's a real challenge. The real important thing in terms of real bad permanent complications, those are really rare. And those are things we just have to mention. It's like driving in a car. The odds of you driving home and having a bad accident is really low. And the same thing with permanent bad problems with facelift surgery. So really just focus on these minor things, temporary things, temporary. They happen. We deal with them, and in short order, they're taken care of.
How long is the recovery from a facelift that you do?
Yeah, so one of the main things we look at is that patients will ask is, when can I get back to my social situation? When can I go back to work? When can I, go to the store? When can I just present myself? I don't want to stay indoors forever. And the number we always give is about 10 days. And we should be, and over 90% of individuals should be presentable. Not completely healed, but presentable, where you're not noticed, where you're not sort of, where somebody can see that you've had something done. So at 10 days, you should be able to get out, maybe with your hair in front of your ears, or maybe with a little bit of makeup on, but you should be presentable at that time. But before then, on occasion, I've had a patient that was looking great at 4 days, but generally, you need about 10 days. But in terms of completely healing, it takes some time for it to completely heal, and we can be patient with that because it's not something that really we notice. But we can feel some firmness in the face and neck afterwards. That takes a while to recover. Mm-hmm. But those aren't things that we really have a good deal of worry about. The thing we really look at is when can we get out? When can we be social? When can we get back to life? We don't want to stay indoors forever. And in the majority of patients, that's 10 days.
Have you seen more facelifts requested now that we've had these shutdowns and lock-ins?
Yeah. So one of the things that people have said recently with this COVID thing is, I want to get it done now because I can wear the mask and just hide everything. So, but yeah, I think that more and more people, of course, are working from home and they're able to take care of themselves at home. Can wear the mask. They've got the time, and so we've certainly seen a lot of that today for sure.
I'm sure you've seen a wide range of results and complications from yourself and other doctors. Can you share a complication that you've seen that has been pretty dramatic? Either one that you had yourself or you saw from someone else?
Well, I'll tell you one interesting, maybe crazy story is a physician in another state that I was overseeing. He did a procedure on a patient and gave the patient lots of normal instructions, and the patient was sort of out of town, and so went to a local hotel and was dropped off, had her caregiver, taking care of her and so forth. But she was inspired that evening and said, well, I think I can drive home. And so got in the car and tried to drive home, but was pulled over. And because she had medications on board, was arrested. So,
She went to jail with a fresh facelift.
Yeah. But it doesn't matter the reason. If you're driving under the influence, then that's reason to be arrested. The thing is, we have very, very important and detailed instructions afterwards. Obviously, let's take care of ourselves. Obviously, let's don't drive the same day. So we do get in trouble on an occasion when those instructions aren't abided by. I have one patient who was an avid golfer, and so 4 days after the facelift went out and golfed and so forth, and came in on the 5th day with lots and lots of swelling, as you'd expect. I had another lady who was gardening. She had to get her gardening done. It was springtime, and there's lots of gardening to do. So 3 or 4 days later, after the procedure, she's out gardening, bending over, and she came back in with lots and lots of swelling. So the overwhelming majority of concerns and complications can be avoided if we just do the right thing. And then the instructions are it's a challenge because one of the instructions is for the first week, do a lot of nothing. And that's a challenge for people. And we usually wear a wrap for a whole week. I had one patient just like recently who, decided he just didn't want to wear the wrap. And so 3 days afterwards, he came in with a little bit more swelling after 3 days. And we really worked hard to try to remedy that. But if you abide by the instructions, a lot of these things are avoided. And those are obvious ones there and so forth. But
I had a patient I did a facelift on who had a really wild complication, really sad story, actually. So this was an African-American woman I did a facelift on, and one of my instructions after surgery is I don't like heat packs. And I don't like hot packs on the face because people are sometimes numb, as you know, and sometimes within the first 10 days of surgery, they might not feel what's on their face. So I had this woman who put a hot pack on her face. It was clearly written on our instructions, don't do that. She fell asleep with it.
Right.
She woke up with a severe burn on her face.
Right. So I've had one patient who, we have a little bit of numbness around the ears. And so she did her hair, curled her hair, and didn't feel it on her ears, had a slight burn on her auricle, on her ear. So there's a whole number of instructions, and if you just abide by them, then so many of these things are avoided. Again, the common things will happen, and we just don't even get too concerned about them. Like I mentioned, the swelling and the bruising, sometimes bleeding, sometimes infection, sometimes bumps and lumps, asymmetry, and those sort of things. And those are remedied in a short order. They're temporary, and we fix those. But bad permanent complications, those are small. Those are low risk. That's less than 1%. Patients who smoke. Now, there's a lot of surgeons that say, no, I'm not going to operate on somebody who smokes, and so that's wise. And I think that's a high percentage of physicians will say that, or make sure that they stop smoking. But there And so that provides an increased risk. Medical history provides increased risk for healing problems. So diabetes and cardiac disease and pulmonary disease and smoking all increase our risk for healing concerns or double the rate of healing and so forth. And so we were very cognizant of that and caution and are careful with those sort of situations. But I certainly have finessed those situations in so much as to treat to do facelifts on those individuals, but it's tailored based on the degree of medical compromise and based on their desires and so forth. So plenty of individuals are not candidates for a facelift, but with the right thought process going into it, many patients can still have facelift surgery even though they have medical problems or even smoking.
One of the common questions I get from patients is, why do celebrities look so weird as they get older? Not all of them, some of them. And the patients tell me these people have the best doctors available. They have all the money they could want, yet they still look really weird, like Sylvester Stallone, Steve Wynn, Glenn Campbell. David, tell me, why do you think they look so funny?
Well, I think that what's interesting is that I've observed a lot of surgeons, a lot of plastic surgeons, and on the whole, plastic surgeons are good surgeons. They're good people. They're smart. They're sharp. They got their board certification and so forth. But with facelift surgery, I think that good facelift surgery is performed by less than 40% of the average plastic surgeons, and there's a whole number of reasons for that. And just because you have a big name doesn't mean that you're a really good surgeon. Just because you've got a big office doesn't mean you're a big surgeon. I think there's a lot that goes into a really good facelift surgeon, and I can name 100 doctors that have observed and can tell you that 2 or 3 of them that I've observed are really, really good, and they're the people other than myself that I would refer a family member to or what have you. But it's really less than 40% that can really get the job done. And what do we need? We need natural appearance. And that's just something that you need the experience, but you also need the know-how and the genetics to provide that sort of result. And so there's plenty of instances where the surgeon might be board certified, might be somewhat experienced, but just can't get it done. As an example, I think there is a correlation between the amount of time it takes to do the procedure and the potential success. And not to say that somebody who rushes through, I rarely see somebody who's just rushing through and just getting it done just to be quick. But I do think that there's many instances where I've seen surgeries done in 4 hours and 5 hours, and the result, they're just not getting the job done efficiently, and the result isn't as good. But I've got many doctors I've seen that just are so efficient, so good, getting it done well, and they can get it done in an hour, get it done in 2 hours, 2.5 hours, and have great results. So not all surgeons are created equal. And when you get a good surgeon, then you should have a great result 99.9% of the time.
So if I'm a patient looking for a facelift, all qualifications being equal, how do I tell who's going to do the right job for me or who's going to be terrible?
Go to church and pray, I think. So I think I think that you've got to have several examples in front of you, friends and family that have had something done, and nurses and so forth, and other doctors who've said this guy's really good or this woman's really good, but just because they've got a nice office or something just isn't enough. And so I think you really have to do some good homework and recommendations from a number of sources: patients, nurses, other doctors, and then when you walk into the room and you talk to the physician, you need to feel real comfortable with them. And then you have to do what I've done before when I've gone to other medical professionals. I ask the question, well, how many of these have you do you do a year? And when someone says, "Well, I do a lot," or something, or I do 10 or do 20, then that's when you want to rethink things. When somebody looks you in the eye and says, "I do about 50 or 100 of these a year, 200 of these a year, and my results are excellent," then that's a person you might feel more comfortable with. So the volume not always is the most important thing, but it's oftentimes is very important. So, if somebody says they do five or, and this is true for almost any procedure, just doing 4 or 5 a year, that's not enough.
hmm So it sounds like one of the most important factors, not the most, all qualifications being equal, is how many is that doctor doing? And you want to go to somebody with high volume. And do you have patients, or let's say someone's asking for a referral, and because you can't do it for whatever reason, do you have them look at the before and afters? How important are those?
Well, before and afters are important, but you go online, you go to the internet, you go to the website. All the best results are on their website or on their Instagram and so forth. So that's helpful. And if they have a lot of pictures, that's helpful too. But again, I think it goes back to having confidence in the surgeon when you talk with them, and having great conversations with other individuals who know about their abilities, including patients, including nurses, including other doctors. And I think those are real important aspects. But just because they got good before and afters, everybody's got one or two good results. But
hmm
but
hmm
we want to know about the last 100 patients. How good were your results in all of those 100 patients?
So do you think it's right, for physicians who don't do high volume procedures like facelifts for them to be allowed to do them?
Well, there's plenty of surgeries where you don't really have to have high volume to do well, and I think that it's under the judgment of the surgeon as to whether that's appropriate or not. But I think when it comes to things like rhinoplasty and facelift, I think you really need to be someone who does a lot, because it's your face, and sometimes if there's a poor technical treatment of these areas, the results can be challenging for a long time. And there's so much we can do in terms of revision, facelift, revision, rhinoplasty, but you just don't want to have to go there. So I think that facelift and rhinoplasty are specific surgeries that you really want to have a surgeon that does it a lot. There's other surgeries when it's not that big of a deal. Yeah, I'm going to ask you your opinion on it, but liposuction, I think
Mhm.
that's not really required that you do a lot of that. I think you can do a pretty decent job just doing simple liposuction for the average surgeon. I think my guess is, and maybe you can disagree with me or not, but
Mhm.
80% or 90% of plastic surgeons do a pretty decent job at liposuction, because I think it's a simple procedure. But when we talk about facelift, as I mentioned, I think it's only 40% of surgeons. That's my guess. That's my estimate. That's my opinion. I don't have a study that shows that. That's a hard thing to really look at, but that's my opinion. And so, yes, I think you want to have somebody who does a lot of it, and who's been successful at it.
I agree with you in the fact that whatever you're gonna do, you have to do a lot of it, right? For example, liposuction, we can talk about that for hours, but that's a procedure that's changed so much, right? When it first started, people were just removing fat with the big tube. What liposuction is today for the true liposculpture surgeon is so different. Now, when people come, just to give you, some insight, just like facelifts, the goal is really to sculpt the body, not just remove volume. And the people that are removing just volume, they're
Right,
not the people
right,
who are doing the real
right,
high-end liposuction that
right, right,
patients nowadays see
right,
and
right,
want. There's
right,
so much to it. And the only way you get there is you got to do a lot of it.
right, right,
And I agree with you. You need basic certifications, you need education. I also feel that anybody can pass the test, right? Which is how you get these certifications oftentimes. But not anybody can do a great case. And from what you said about high volume really resonates in what I believe, because you need that. And I think it's true in any trade, any profession. Wouldn't you say so?
Well, there's this study that I read a while back ago that just essentially blew me away. It was this hospital in Canada whereby the surgeon, it's strictly a herniorrhaphy hospital. And so all the surgeons there, that's all they do. They just do herniorrhaphy. You say, well, that's just a simple procedure. Who cares? Well, their numbers beat numbers elsewhere by a mile. In other words, their revision rate is like half what it would be in any other hospital. The time that they do the surgery is half as long as the average general surgeon, and complication rate as well. So it's the volume. And it's not just the surgeon. You think, well, the surgeon's really good because that's all he does is herniorrhaphy. It's the team too. You've got these nurses and assistants that are helping, and they're doing the same. They're becoming experts themselves, and they're providing that little bit that provides a better result, less complications, less revision rate, and so forth. So the team is part of it as well, not just the surgeon. In fact, if I was to go out and do a facelift at the local hospital, then I'd have to use the nurses and assistants that the hospital has. I have to teach them everything that needs to be done. And what about the equipment and so forth? So it'd take me twice as long to do. So the team is part of that equation too as well. And that's an important aspect too. But definitely volume is important. Definitely experience. Definitely certification. All those things are important. But I think there's some genetics to it too. I think you need to be someone who can, because I've seen the opposite where the physician is just, or surgeon is just fumbling around, not a lot, but enough to notice, and enough for me to say, I don't think I want to send my mom and my sister to this person.
Absolutely, David. I'm totally with you on that. David, you've shared so many amazing insights with us. When you think about facelifts and reflect back on your career, if there was one insight, piece of information that you would want to share with people who are thinking of getting this done, what would you tell them?
Well, I think that there's plenty of misconceptions about facelift surgery. That comes from Hollywood, right? Because the only exposure that most individuals have over the years has been, that bad facelift from the actress and actor and so forth. And so we perceive it as expensive, as only for the Hollywood elite, and it's risky because we could end up looking like one of those bad results. But the truth of the matter is it's not that expensive. It is really safe. If you get someone who does this a lot, you're in good hands. Someone with good experience, then you're in good hands. And there's more people that have had it done than you might imagine. You've probably the average person probably has friends or family that have had it done, and they don't know about it because it's so natural appearing. So natural is the commonplace when you're talking about a good facility, good surgeon, and the abnormalities and bad results that you see in Hollywood are really the rarity, I think.
Absolutely. I absolutely agree with you. David, thank you so much for coming on the show today. I have learned a lot from you, and I know our listeners have too. I'm honored to have you as a friend and a confidant, and someone who I also often seek advice from in my career.
Great to be here. I love the music and love talking with you.
Where can patients find you if they want to get in touch with you?
You can find a lot of good information before and afters and some entertainment on Instagram at Dr. Dr. David Santos. But also website is facialbeauty.com as well.
That's awesome. Thanks for listening to the Plastic Surgeon Podcast, and tune in next week for my guest who's going to have an amazing patient story. Catch us on all social media at Real Dr. Seattle, and watch me on Snapchat. Bam, what?